What is the difference between hamartoma and choristoma? That is also known as heterotopia. So hamartoma is this tissue is normally present in that region or that organ, but the organization of the tissue is disorganized. The tissue is not following the normal architecture. That is called hamartoma. Say, firstly, most common is pulmonary hamartoma. Can you name the syndrome associated with pulmonary hamartoma? Do you know? Carney's triad. Have you heard? It's associated with pulmonary hamartoma. Apart from that, even some benign lesions are also called hamartomas, because the difference between a hamartoma and a benign lesion is very small. So tell me, what is associated with tuberous sclerosis? Renal? Do you know? Tuberous sclerosis is ki hai? Angiomyolipoma. Right? So what this has? Three components. Angio mane blood vessels, myo mane muscle, lipoma mane fat cells. These three tissues are normally found in the kidney, right? Je kono organei to thakbe, muscle thake, fat cells thake, blood vessels to of course thake. Every organ has blood vessels, but it is growing in a disorganized manner. So it can be called a hamartoma. So there are some authors or some researchers who believe that these, or say any hemangioma, some authors believe that these are actually hamartomas, because they also don't harm the patient at all, almost at all, unless they are growing so large that there's some pressure effect. So that is called a hamartoma. And what is choristoma? Or it is more commonly called heterotopia. So what is that? Says this tissue is not normally found in this organ, like you're finding pancreatic tissue in the stomach, right? Or say adrenal tissue in the ovary. So then it becomes actually very difficult for the pathologist to say whether this is a normal tissue in an abnormal location or some other neoplastic process. And not only that, any tissue can develop carcinoma or malignancy, right? So in these heterotopic tissues, they can also develop carcinoma, and then it becomes a bigger problem, because now we have to determine whether it was originally present in this tissue or it is a metastatic deposit, right? So we have to know the difference. Are question ta ashe? Acha, common tumors of infancy and childhood, benign, malignant kore start karo. তো জানে, সবাই জানে, I'm sure you know. Vince tumor, malignant, benign, retinoblastoma, benign. আমি নাম বললাম তো benign tumor যে, হ্যাঁ। আর কমনলি আমরা benign hemangioma বাচ্চাদের হয়, কমন এটা, রাইট? অনেক বাচ্চাদেরই দেখবে মুখে লাল লাল দাগ থাকে, even my son has that, thankfully মুখে নয়। আর বাচ্চাদের আর কি হয়? হ্যাঁ, ফাইব্রোম্যাটোসিস। অ্যান্ড আর একটা কমন টিউমার যেটা ক্যান বি বিনাইন, মোস্টলি বিনাইন বাচ্চাদের হয়, টেরাটোমা। অ্যান্ড মালিগনেন্সে একটা তো বললে ভিন্স টিউমার, আর রেটিনোব্লাস্টোমা, আর দুনিয়ার ব্লাস্টোমা। আর কি কি ব্লাস্টোমা জানো? আর ইয়েস, আর ব্রেনে মেডুলোব্লাস্টোমা। আর okay, we'll come to each. Acha, most common malignant tumor of childhood? This also everyone knows. Everyone knows. কোনটা commonly হয় সবচেয়ে? Leukemia is a malignant tumor. So we come to the benign tumors. So egulo ki? Yes, hemangioma. So as I said, hemangiomas are proliferation of blood vessels. So it can be cavernous hemangioma, jeta usually venous moton thake, and capillary hemangioma, which are made of capillaries. Now these hemangiomas are usually found in the face, head and neck region. And startlingly, the most common thing is, say a child comes with hemangioma, the mother will be worried. But most commonly it disappears. Automatically it gets sclerosed, the blood vessels get sclerosed and the hemangioma disappears. Within say 2 years, 3 years or 5 years, the hemangioma may completely disappear. Have you heard of port wine stain? এই কোয়েশ্চেনগুলো আসে, port wine stain. Port wine stain is also a kind of hemangioma where the hemangioma is actually flat, it is not raised. এখানে ছবি আছে port wine stain. এই যে this one. The hemangioma looks like basically wine এর মতো দেখতে লাগছে, মুখে যেন ওয়াইনের দাগ লেগে আছে. Port wine stain. This is also port wine stain. But sometimes hemangiomas can also cause a problem when they are located inside the CNS. Right? Name a syndrome which is associated with cerebellar hemangioma. VHL, von Hippel-Lindau disease. Right? It is associated with cerebellar hemangioma, chromosome 3p. VHL is also associated with clear cell renal cell carcinoma. So this is an example of cerebellar hemangioma. So some basic tenets is in children, mostly they can also come with genetic mutations. The syndromic association is more commonly found in children. Obviously, they are born with some kind of mutation, and that is why they are developing this kind of tumor. It is, of course, can also be acquired, but more commonly the syndromic or genetic mutation and tumors associated with these mutations are found in children, which can be benign or can be malignant. What is found in tuberous sclerosis? Brain tumor er moton mass thake. That is why it's called tuberous sclerosis. Tuber mane alu. So these are examples of hemangiomas. These are usually raised. This, if we see, this is most commonly formed of capillaries, small capillaries, but it will be well defined. It will not metastasize or infiltrate into the surrounding tissue, right? But hemangiomas in children are usually more cellular than those found in adults. However, they disappear, but in adults they won't disappear. Hello, this is an example of multiple hemangiomas. বলো, এই জন্যই বলি তো সামনে বসো, সব পেছনে বসবে দেখতে পাবে না, কি জানি কি করছে. What is so important that you cannot spare 30 minutes. বলো, লাস্ট তুমি মারুন জামা তোমার পেছনে, বলো. Please stand up. Bolo, you cannot see. Yes, sit down. Next, another common benign tumor hoche fibrous tumor. Right? Fibrous tumors can be benign, can be malignant. When it's benign, it is called fibromatosis. When it's malignant, it is called fibrosarcoma. Right? So again, fibrosarcoma can occur in children, can occur in adults, but fibrosarcoma is a kind of common tumor found in children. and the mutation associated with it is ETV6 NTRK3. Right? What happens is these are spindle-shaped cells. Basically, spindle-shaped cells, এরকম nucleus থাকবে. যদি benign হয়, তাহলে it behaves like a benign tumor. It will just be a mass which can cause pressure effect, but it will not infiltrate. In fibrosarcoma, it infiltrates into other tissues, but in children, it is commonly curable. Usually, chemo, radio, আর তারপরে excision করলে it's curable. আর malignant tumor আর কি থাকে? Destruction of the surrounding tissue আর mitosis. তো fibrosarcoma-তে অনেক mitosis থাকে. Next, teratoma. So, teratoma is another tumor which goes from the spectrum of benign to malignant. Do you know what is found in benign teratoma? Teratoma is a kind of tumor where all kinds of tissue are present. Like epithelial tissue will be present, mesenchymal tissue will be present, neural tissue will be present. Right? 3 kinds of tissue will be present in teratoma. It is usually most commonly benign. There are 2 peaks in the age distribution of teratoma. Sometimes or most commonly it occurs in less than 2 years of age. Another peak is late adolescence or early adults. Right, there are 2 peaks. Do you know what this is? এটার একটা স্পেশাল নাম আছে? না, hydrocephalus মাথায় হয়. Yes, sacrococcygeal teratoma. It is commonly found in newborns for less than 2 years. It is sometimes associated with spina bifida and some cloacal abnormalities, right? Or it can be just alone sacrococcygeal teratoma. Apart from that, teratomas are found in testis and ovaries. This is testis, this is ovary. তো দেখতে পাচ্ছ টেরাটোমাতে এরকম একটা চুল, দাঁত সব থাকে. চুল, দাঁত, fat and sebaceous tissue like keratin. Very commonly it is found. So ovary মধ্যে এরকম নিয়ে আসে. Can also occur in adults, and these cases are usually benign. For a teratoma to be immature, we have to find primitive neuroectodermal tissue. Right? Primitive neural tissue মানে brain tissue যদি well developed brain tissue হয়, যদি glial tissue থাকে, it is well developed. Sometimes teratomaতে চোখের টিস্যুও কিছুটা পাওয়া যায়. রেটিনা সব তৈরি করছে. And we have seen many cases. Everyone has seen many cases of this. But if it contains immature neural tissue, then we think that this is an immature teratoma. Or it can be frankly malignant. Frankly malignant teratoma is usually a part of mixed germ cell tumor. Right? So it is then associated with other germ cell tumors. What are other germ cell tumors? Do you know the names? Have you heard of choriocarcinoma? Yolk sac tumor? So it is then associated with other these kinds of tumors. And then it is a part of mixed germ cell tumors and it is malignant. And this also is usually curable. In pediatric, these tumors are usually curable. You give good chemo, they have a good 5-year survival rate. So next, malignant tumors. Now, there are some basic things. What do you think, which are the most common tumors, malignant, say, in adults? Common malignant tumors in adults, bolo? যেগুলো নিয়ে বিভিন্ন no shave November হবে, এই হবে, ওই হবে. What? To raise awareness for what? You have all participated in No Shave November. শোনোইনি? নো শেভ নভেম্বর হয় না, প্রত্যেক বছরই এগুলো নিয়ে বিশাল ইনস্টাগ্রামে চলে। হয়তো এটা তো দেখেছো লোকজন দাড়ি নিয়ে ঘুরে বেড়াচ্ছে। কেন করছে? তারা জানেই না কেন করছে। টু রেজ অ্যাওয়ারনেস ফর প্রস্টেট কার্সিনোমা, রাইট? আর কি হয়? ব্রেস্ট ক্যান্সার অ্যাওয়ারনেস উইক হয়। কালকে কি ছিল? ও কালকে তো তোমাদের ডাউন ছিল, তার আগে কি ছিল? ব্রেস্ট ক্যান্সার ছিল। আর তোমাদের ওভেরিয়ান ক্যান্সার নিয়েও কি একটা অ্যাওয়ারনেস কি একটা ছিল না? হয়নি না? কি জানি হবে মনে, কোথায় একটা দেখলাম, যাই হোক। So what are these? Carcinomas, right? Ovarian carcinoma. Breast cancer is carcinoma. Prostate is carcinoma. Carcinoma মানে কোথাকার? Epithelium. And I am talking about these tumors. এগুলো কোথায় হচ্ছে? Usually mesenchyma. Fibrosarcoma mesenchyma. Right? আরো আমি tumors বলবো. So more commonly children have mesenchymal tumors. Right? Leukemia মানে কি? মানে mesenchymal connective tissue, তাই তো? ব্লাড মানে কি? কানেকটিভ টিস্যু। So that, and in adults it's usually epithelial tissue. একটা ডিফারেন্স। দুই, there is a close relationship between organogenesis and development of tumors in children, and we will see the associated syndromes and the genes which is associated with organogenesis and also tumorigenesis. So in children it is closely associated. 2. 3. There is a lot of research into childhood cancers, and in fact childhood cancers are the most common cause of death only after road traffic accidents in children in the USA. Right? So it is a very common cause of death among children. So a lot of research is done into it, and we are trying to treat childhood cancers, and there is a lot of success associated with treating childhood cancers. So now there is a child who is 2 years old, 5 years old, has been treated with radiation. What happens in these children is, in later in life, they may develop a second malignancy. It's very unfortunate, but these people develop a second malignancy because of this radiation that they received or the chemo they received. They may develop a second malignancy. So radiation oncologists have to be very judicious when they are treating these cancers. So in childhood cancer, we see they later on in life they can develop, say, lung carcinoma, breast cancer. These children develop. Okay. So now the common malignancies 0 to 4 years. দেখো leukemia দুটোতেই আছে, and you will next তোমাদের তো anemia, leukemia এগুলোই হবে next. So leukemia is there in both. So 0 to 4 years এ কি হয়? Leukemia, retinoblastoma, neuroblastoma, Wilms tumor, hepatoblastoma, soft tissue sarcoma, including rhabdomyosarcoma, teratoma, CNS tumors. 5 to 9 years এ কি হয়? Leukemia, neuroblastoma, hepatocellular carcinoma, soft tissue sarcoma, Ewing, CNS, lymphoma. 10 to 14 years এ renal cell carcinoma, hepatocellular carcinoma. This from Robbins. Soft tissue sarcoma, Ewing's, osteogenic sarcoma, lymphoma. Right? Now lymphoma, another lymphoma you will be taught separately, but just one thing, Hodgkin's lymphoma also has 2 peaks. I think you had a question from Hodgkin's only, right, in the prof. So Hodgkin's lymphoma has 2 peaks, right? One is in childhood, especially 10 to 20 or 10 to 15 years. And then later in life, a 30 or 35-year-old may come with Hodgkin's lymphoma. So it has 2 peaks. Another tumor which has 2 peaks, do you know? Osteosarcoma. So now what are these small round blue cell tumors? In children, most commonly we get small round blue cell tumors. These cells basically, the name says everything. The cells are small, they are round, they are dark blue like lymphocytes and have very little cytoplasm. They look like lymphocytes. So pathologists may confuse them with lymphoma, right? So these are small round blue cell tumors. Now in this we get neuroblastoma, nephroblastoma. Nephroblastoma mane Wilms tumor. Neuroblastoma, nephroblastoma, Ewing pinate, primitive neuroectodermal tumor mane pinate. Lymphoma, medulloblastoma, retinoblastoma, and rhabdomyosarcoma. These are all the small round blue cell tumors. These are the common malignant tumors in children. So this is, you can see the cells. They are small, they are mostly round, they are very blue, right? So what happens is, it is a common tumor in children, 2 to 7 years usually they present, or maybe in childhood. And that this age is very important because age is associated with prognosis. In neuroblastoma, if the age of presentation is less than 18 months, it is associated with excellent prognosis. And if the age is more than 18 months, very bad prognosis. So rather bad prognosis. There are lots of prognostic factors. They commonly develop from sympathetic ganglia or adrenal medulla. So ওটা কোথায় usually sympathetic ganglia কোথায় থাকে? Vertebral chain এ, vertebrae পাশে, আর কোথায় থাকে? আর adrenal retroperitoneum. So the child usually presents with an abdominal mass or abdominal pain. So if a child is presenting with, you get questions like this, child is presenting with abdominal mass, and there will be other some symptoms of neuroblastoma like abdominal pain. So then you have to diagnose neuroblastoma, right? So they come with the neuroblastoma children come with an abdominal mass. And what are these? These are called rosettes, right? একটা হয় হোমার রাইট রোজেট, আরেকটা কি হয় রোজেট নাম জানো? ফ্লেক্সনার উইন্টারস্টাইনার রোজেট, ঠিক আছে? হোমার রাইট রোজেট মানে সিউডো রোজেট, এইরকম মাঝখানটা কিছু নেই, और মাঝখানটাতে একটা প্লেন পিঙ্ক ব্যাকগ্রাউন্ড আছে, লাইক হিয়ার দিস আর হোমার রাইট রোজেট, ব্যাকগ্রাউন্ড আছে, সেটাকে ঘিরে সেলস আছে, দিস ইজ নোন অ্যাজ হোমার রাইট রোজেট আর সিউডো রোজেট, মাঝখানটা নিউরোপিল থাকে। So these small round blue cell tumors, usually we find these rosettes. It helps us diagnose. And flexular intestinal rosette আমি বলবো। So now another thing is neuroblastoma can be very small, about a millimeter in size, or can be very large in size. Like I told you, they will come with abdominal swelling and abdominal mass. So these small tumors may not even be diagnosed, they can spontaneously regress. So this is another feature of childhood malignancy. The tumor আছে নিজে নিজেই সেরে গেল. It's a very fortunate outcome. It can happen in childhood malignancy, is not usually found in adult. So in neuroblastoma, this is commonly found. So that is why some researchers believe that small neuroblastomas are not malignant tumors at all. Right? আর কি syndromic association, anaplastic lymphoma kinase, ALK বলে একটা জিন থাকে। ALK gene mutation is associated with syndrome which consists of neuroblastoma, right? Are key, they can have chromosomal abnormalities, right? So they can have whole chromosome gains, and that is associated with better prognosis in neuroblastoma. Whereas they can have a phenomenon called chromothripsis. Chromothripsis মানে partial chromosome gain হচ্ছে. If that is present, it is associated with worse prognosis, right? আর হচ্ছে if there is mature tissue present in the neuroblastoma like ganglion cells or Schwann cells, these are mature tissues, ganglion cells, Schwann cells. If these are present, it is associated with good prognosis, and if these are not present, it is associated with poor prognosis. Another is the, I told you, age less than 18 months, more than 18 months. Another is stage. If the child has early stage neuroblastoma, then it is associated with good prognosis, otherwise it is associated with poor prognosis. Usually, children present at a later stage. Usually. No? Now, sometimes neuroblastoma, this is obviously a newborn, you can understand. Now, these newborns can present with metastatic neuroblastomas. Neuroblastoma can metastasize to the lungs, to the brain. আচ্ছা মেটাস্ট্যাসিসের একটা ফর্মুলা মানে কোথায় কোথায় ইউজুয়ালি মেটাস্ট্যাসিস হয় জানো তো? লাং, লিভার, ব্রেন, বোন ম্যারো। লাং, লিভার, ব্রেন, বোন ম্যারো। ঠিক আছে? So, but here it can of course metastasize to the lungs, to the liver, to the bone marrow. Also, it can metastasize to the skin, like in this case, where you can see these spots on the child. You can see gol ache. These are actually neuroblastomas. The child has presented with, so possibly the child was suffering in utero from neuroblastoma, and now has presented with metastatic neuroblastoma at birth, and it is called blueberry muffin baby. Neuroblastoma, it is associated blueberry muffin baby. Bolo, a 28-year-old woman, gravida 1, parity 0, mane first pregnancy. Gravida 1 mane first pregnancy. Has an uncomplicated pregnancy until 28 weeks of gestation, when she develops uterine contraction and has premature rupture of membrane. One, she has gone into labor. An ultrasound reveals the lesion with representative gross appearance shown in the image. The question ta Robin se ache. Next, Wilms tumor. Nephroblastoma. So, Wilms tumor is a tumor which shows the relationship between organogenesis and tumorigenesis. Chromosome, do you know Wilms tumor chromosome gene naam ki? 11p is the chromosome, rather gene. Gene tar naam? Very easy to remember. WT1. WT1, WT2. These are the two genes, right? Wilms tumor, ota theke esche, right? So this WT1 gene is associated, is rather involved in the organogenesis of kidney and ovaries, gonads, all this, right? So if there is mutation in WT1, it develops, the child will not only have some problem with the organ development of the kidney, of the gonads, but also can develop Wilms tumor. Bojha geche? So, do you remember the Knudsen two-hit hypothesis I had taught? Two-hit hypothesis পড়িয়েছিলাম তো? আগের ক্লাসটাতেই পড়িয়েছি, ভুলে গেছি। কিসের কোন জিনটা কি ছিল? আরবি জিন ছিল। So, WT1 এও two-hit hypothesis হয়. The same function works. The child is born with one mutated WT1, and the second hit occurs during the childhood of the baby or the child of the infant, and then develops Wilms tumor. Right? Same. So, name some syndromes associated with Wilms tumor. বলো। হ্যাঁ, ডাব্লিউতে কি হতে পারে? উইলস টিউমার। এতে অ্যানিরিডিয়া। জিতে এটাও বলেছি জেনিটো ইউরিনারি অবনর্মালিটিস, ডেভেলপমেন্ট হচ্ছে না, জেনিটো ইউরিনারি অবনর্মালিটিস। আর এ মেন্টাল রিটার্ডেশন। আজকাল আর মেন্টাল রিটার্ডেশন তো বলে না, যাই হোক। তো দিস ইজ ওয়াগ আর WT1 11p13, রাইট? তো এই বাচ্চাদের এটা হয়। আর সিনড্রোম আছে আরো, ওগুলো কোয়েশ্চেন আসে, স্পেশালি এমসিকিউ আসে। Okay, Denise-Drash syndrome. It is also associated with Wilms tumor. The same gene, WT1. But the kind of mutation here is different. In Denise-Drash, it is not 11p13. It is associated with the zinc finger region of WT1 gene. You don't have to remember zinc finger region and everything. Just WT1 এর গন্ডগোল হয়, Denise-Drash হয়, এদের কি হয়? Gonadal dysgenesis and early onset nephropathy. There হবে হচ্ছে diffuse mesangial sclerosis. You will learn diffuse mesangial sclerosis later. There basically early onset nephrotic syndrome হয়, early onset nephropathy and gonadal dysgenesis হয়। তো এদের দুটো টিউমার হয়, একটা তো বললাম Wilms টিউমার, আর একটা টিউমার হয় গোনাডোব্লাস্টোমা, বিকজ অফ গোনাডাল ডিসজেনেসিস, মেল সিউডো হার্মাফ্রোডিটিজম। বুঝেছো? গোনাডাল ডিসজেনেসিস হলে এটা হয়, রাইট? So they also come with gonadoblastoma. আর একটা সিনড্রোম আছে associated with this, কোথায় লিখবো? Beckwith-Wiedemann syndrome. এটাতে কোন জিন থাকে জানো? WT2। (11p15.5) অত জিনের লোকেশন আই ডোন্ট থিঙ্ক অ্যাটলিস্ট প্রফিট অফে আসবে না, বাট এটা এমসিকিউ তো ফ্রিকোয়েন্সি আসে, ইফ ইউ চেক দ্য এমসিকিউ বুকস দেখবে। Beckwith-Wiedemann syndrome, this is associated with omphalocele. Omphalocele মানে জানো? Omphalocele and eye problems, right? Developmental problems in the retina. Along with that, adrenal cytomegaly, organomegaly, macroglossia. এগুলো থাকে সঙ্গে Wilms টিউমার, ঠিক আছে? ম্যাক্রোগ্লসিয়া, অর্গানোমেগালি, adrenal cytomegaly, developmental abnormalities in the eye, and omphalocele. This is Beckwith-Wiedemann syndrome. So এটা হলো, but Wilms tumor যত হয়, it is the most common childhood tumor of the kidneys, in most common childhood tumors in the kidney, Wilms tumor, and most commonly it is not syndromic. The more common presentations are not syndromic. If there is syndromic presentation, the presentation is earlier in age. Wilms tumor usually 2 বছর অবধি develop করে usually. So, but the children who have syndromic association of Wilms tumor present 10 months earlier than the non-syndromic association children. Apart from that, Wilms tumor can be unilateral, can be bilateral. If it is bilateral, there is more chance of syndromic association, right? এবারে morphology, you can see the gross Wilms tumor gross. এটা ডেভেলপিং কিডনি, এরকম একটা ওয়েল সার্কামস্ক্রাইবড ট্যান টু গ্রে কালারের একটা মাস থাকবে with areas of necrosis and hemorrhage. আর ব্রেন টিউমারে 3 রকম কম্পোনেন্ট থাকে। One is the blastemal component, which is the small round blue cell, right? আর একটা থাকে হচ্ছে mesenchymal component, which is the stroma. এরকম যেরকম বলেছিলাম এরকম spindle cell stroma থাকে সেটা। Apart from that, there is the epithelial component, which is the glomeruli. There are some abortive tubules and glomeruli present in Wilms tumor, right? This is the microscopy. 3 components: blastemal, epithelial, and mesenchymal. Apart from that, Wilms tumor can have some mitotic figure, and if there is the presence of atypical mitosis, then it is associated with poor prognosis. The Wilms tumor is also easily cured. Like 30 years ago, the survival rate for Wilms tumor was about 40%, but now it is more than 90%. So children with Wilms tumor can develop a second malignancy later in life. What is done is chemotherapy is given, and then maybe they just cut out the tumor. That's all. All right. Yes, von Hippel-Lindau. Next, এগুলো ছোট করে rhabdomyosarcoma. Rhabdomyosarcoma common location is the head and neck region, sinuses, around the nose, maxilla. This region can also be the eye, and also in the abdomen region and the genitourinary region. Right? So these are the common locations of rhabdomyosarcoma. Have you heard of sarcoma botryoides? That is also a kind of rhabdomyosarcoma. Right? So it is also a small round blue cell tumor with some muscle differentiation. Rhabdomyo means skeletal muscle. So they have muscle differentiation. Ewing sarcoma. Ewing sarcoma is the second most common osteogenic tumor in children. Osteogenic tumor, যেটা সবচেয়ে common নাম বলো? Bone tumor, most common osteosarcoma. Is the most common osteosarcoma. Second most common Ewing's. Both occur in children. Right? So Ewing's, the common location is around the knee joint. It arises from the diaphysis of the bone. Metaphysis, diaphysis mone ache? It arises from the diaphysis around the knee joint. Mane distal femur, proximal tibia. Apart from that, flat bones like the pelvic bone. ঠিক আছে? Humerusেও হতে পারে. Now, this basic thing that you must know is whenever there is any kind of injury to the bone tries to lay down new bone on top of that. This is called as periosteal reaction. ঠিক আছে? দেখবি এক্সরেতে কমনলি লেখা থাকে, কোনো বোন হয়তো আঘাত পেয়েছে কেউ, এক্সরেতে দেখবি কমনলি লেখা থাকবে periosteal reaction. Right? So it happens also in osteomyelitis. Periosteal reaction is also found in osteomyelitis. Early osteomyelitis will have periosteal reaction. So now what happens is the bone plate is raised because of the growing tumor. The bone plate is raised. Now there is new bone formation on top of that. After periosteal reaction. How it is growing? Another periosteal reaction. এরকম গ্রো করছে, একটা পেরিঅস্টিয়াল রিঅ্যাকশন, এক্সরেতে এটা একটা পেরিঅস্টিয়াল রিঅ্যাকশন, আর একটা পেরিঅস্টিয়াল রিঅ্যাকশন, আর একটা পেরিঅস্টিয়াল রিঅ্যাকশন. ইট গোজ অন. সো দিস ইজ onion skin appearance in the X-ray. This is commonly found in Ewing sarcoma. The common sign and a question is asked from this onion skin reaction. ঠিক আছে? And obviously it is a small round blue cell tumor. এরকম লিম্ফোসাইটের মতো দেখতে স্মল রাউন্ড ব্লু সেলস থাকবে। There will be mitotic figures, it will be infiltrating, it is also chemoresponsive and the survival is good. Next, osteosarcoma. Do you know what this sign is called? X-ray te question আসে এটাতে। Have you heard of Codman's triangle? Codman's triangle. So what happens is the patient presents usually with pain. I have seen when I was doing ortho clinical rounds ortho. So the patient had a huge mass, এত বড় mass. It was a 17-year-old boy who was admitted. আর স্যার ওকে অ্যাডমিট করে রেখেছিল জাস্ট টু শো আস। এনিওয়ে এত বড় মাস, জিজ্ঞেস করলাম যে কবে থেকে এসে, উই হ্যাভ টু টেক দ্য হিস্ট্রি, রাইট, কবে থেকে হয়েছে এটসেট্রা। বলছে যে না কিছু হয়নি, খুব ব্যথা, পড়ে গেছিলাম তারপরে এরকম খুলে গেছে। This is what they commonly say. It presents with pain because of pathological fracture. Do you know what is pathological fracture? Pathological fracture মানে without any injury bone break হয়ে যাচ্ছে, that is called pathological fracture. Usually হয় osteoporosis এ হয়, right? তাছাড়া প্লাজমাসাইটোমা, প্লাজমা সেল মায়োলোমা এগুলোতে হয় pathological fracture, also osteosarcoma, right? So that is what the patient gave me a history of, মানে বইতে যা লেখা আছে সেটা একদম লিটারালি এত বড় মাস he didn't notice, যখন লাগলো then he noticed, and that is how it is so fast growing. That is why the patient didn't notice. যদি অনেক দিন ধরে হতো, the patient would have noticed before the pathological fracture occurred. Usually osteosarcoma is more common in males, you know this. The gene associated with osteosarcoma, RB gene. RB gene is associated with retinoblastoma and osteosarcoma. So what happens is in osteosarcoma, the patient firstly presents with pain and swelling, usually occurs around the knee joint, also can occur in the humerus region and other long bones. It is a metaphyseal tumor and this is the gross appearance. It is a very fast growing fleshy kind of appearance of the tumor, and then it penetrates. This is the cortex of the bone. Cortex and medulla থাকে তো bone. So this is the cortex of the bone. It has infiltrated through the cortex of the bone. There are breaks and it has infiltrated through the cortex of the bone. It has also infiltrated the medullary cavity. It will also infiltrate the joint capsule. It will glow along the tendons and joints, and it will come as a huge swelling. And then there is this periosteal reaction. The bone is still trying to lay down some new bone on top of that. This is the periosteal reaction. So this is the this is the actual bone. There is the mass. This is growing. This is the periosteal reaction. This triangle is called the Codman's triangle. It is a sign of osteosarcoma, radiological sign of osteosarcoma. Now in osteosarcoma, it is of course a small round blue cell tumor. So there will be small cells. Along with that, it lays down bone. This is the microscopic appearance of bone, right? So there is new bone formation, can be mineralized, can be unmineralized. New bone formation, lace-like new bone formation is found in osteosarcoma. To diagnose osteosarcoma, we have to see these new bone formation, right? Apart from that, there are some mitotic figures. তোমাদের prophase, anaphase এগুলো মনে আছে তো? So those actually appear as mitotic figures under the light microscope only. যে microscope তোমরা দেখো ওতেই mitosis দেখা যায়. That is called, normally কি হয়? এই রকম হয় mitosis গুলো, মনে আছে ক্লাস স্কুলে পড়াতো, right? But say the mitosis becomes like this. এখানে হচ্ছে অ্যারো দেওয়া আছে, একটা অ্যারো দেওয়া আছে, দেখছো, ওটা তো ওই রকম নেই, that is the atypical mitosis. Or এরকম tripolar, that is also atypical mitosis. It is the surest sign of malignancy, atypical mitosis. একটা atypical mitosis দেখলাম মানেই malignant, can never be benign. হলো। আচ্ছা, osteosarcoma prognosis. Because of the natural history of the disease, it is considered that osteosarcoma has already metastasized at presentation. Right? Do you remember, have you seen the book or the movie Fault in Our Stars? দেখেছো, পড়েছো? জন গ্রিন, ওটার থেকে তো একটা ওনার লাস্ট মুভিটাও হলো না হিন্দিতে? ওটাতেও আই থিঙ্ক সেম টিউমারই ছিল, বাট আই রিমেম্বার ফল্ট ইন আওয়ার স্টারসে যে মেন ক্যারেক্টার, হি হ্যাড অস্টিওসার্কোমা, and like this is a spoiler, but ultimately he presented with the metastasis of osteosarcoma. Commonly metastasis hoy lungs e at presentation. We always consider that osteosarcoma is presenting with metastasis to the lungs. Metastasis tar ekta naam ache, snowstorm lung. Lung field e choto 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 dot prochur thakbe, like a snowstorm. It is called snowstorm lung. Right? So obviously the prognosis is not very good. In the book, the hero dies. So, but with chemotherapy, if there is first response of chemotherapy is very good, then we can prolong the survival. Next, medulloblastoma. Medulloblastoma কোথায় হয়? By definition, cerebellum এ হয়। এখানে দেখা যাচ্ছে এটা, right? It is friable, it is gray white in color, and the prognosis is actually poor. In case of medulloblastoma, the prognosis is poor. Now the child will present with some ataxic problems, and apart from that, it is a small round blue cell tumor with the same Homer-right rosettes are also found in medulloblastoma. Right? The gene associated with medulloblastoma is one is the SHH pathway, sonic hedgehog pathway. Right? Another is the Wnt beta catenin, কিছু লেখাই পড়ছে না এটা দিয়ে, Wnt beta catenin pathway. So there are two pathways for the development of medulloblastoma, SHH pathway and Wnt beta catenin pathway. Wnt beta catenin pathway is associated with better prognosis. SHH pathway tumors are associated with poor prognosis. Survival is actually not that good for medulloblastoma. There are lots of mitotic figures and these rosettes, Homer-right pseudo rosettes, here, অনেক rosette আছে এখানে। Now last tumor, retinoblastoma. Retinoblastoma associated gene is the RBG, and it can be syndromic or sporadic. Sporadic is more common. Now in retinoblastoma, it presents with obviously blindness and mass and headache. It develops from neural tissue present in the retina, right? Not eye cells per se, it develops from neural tissue, primitive neural tissue. And retinoblastoma spreads along the nerve, right? Ophthalmic nerve. It spreads along that nerve and it can invade into the brain, right? So it commonly invades into the brain and it kind of tries to form, this is more of an embryonal eye. It kind of tries to form the retina. The tumor is kind of trying to form the retina. This is what a retina looks like in the embryo. This is a rosette and I will show it. So this is called a Flexner Winter-Steiner rosette. ফুলের মতন হবে, যেমন এই ফুল হয় ওই রকম একটা গোল ভেতরে ব্লাড ভেসেল বা কিছু থাকবে, and then these are the cells. Fibrovascular core থাকবে, and then it will be surrounded by the cells. This is called Flexner Winter-Steiner true rosette. Right? Along with that, there will be lots of necrosis. And when there is necrosis, there can be calcification. What is this calcification called? Dystrophic calcification. Bolo. That's it. Bolo, difference between hamartoma, choristoma. যারা আগে উত্তর দেয়নি তারা বলবে। So feedback. বলো, ও যারা মাথা নিচু করে আছো ম্যাডাম, বলো। Yes, you. Stand up. বলো, what is the difference between hamartoma and choriostoma?
There are how many types of analgesics? Anyone? Different types of analgesics. What is analgesic? Or what is analgesia? Relief pain. So what are different types of analgesics? Primarily two types. One is NSAID, non-steroidal anti-inflammatory drugs, where it is used not mild, it is in the somatic syndrome. That means if there is a fracture of bone, muscle, tendon pains, we use NSAID, whereas opioid is a different. Why? It is acts on a visceral pain, and they have a effective, মানে psychosomatic brain এ একটা effect আছে, effective component along with visceral pain. Now give an example of a visceral pain. What is it? Where we used opioid? Visceral pain, where we give opioids primarily. CVS completed? Not, na? Acute myocardial infarction. Acute myocardial infarction, it is a visceral or somatic pain. It is a visceral pain. Here we use morphine. Clear? So morphine primarily used in visceral pain, it has a effective component, psychosomatic component, whereas the peripheral pains, that means mostly muscle, tendon, bones, we prefer NSAID. Why? Because they devoid of the side effect of opioid. Now I think what you are already taught, what are the side effects of opioid or morphine? Sedation, more importantly respiratory depression or CNS depression. These two is not present with the NSAID. So in small or bearable pain, like if there is a fracture or if there is a muscle pain, muscle tear, we prefer NSAID because it devoid of side effects of opioid. Whereas we preferred opioids in severe visceral pain, where there is also a effective component other than its analgesic effect. So it has two components. One is spinal component and supraspinal component. So that means spinal means in the spinal cord, and supraspinal means spinal brain. So they have two components. Now we start today from the receptor, different receptor of the opioid. There is three types of primarily. One is mu, kappa, delta. Mu, kappa, delta, and all these three have a analgesic effect, have a respiratory depression effect. But you have to, for mu, it is supraspinal as well as spinal, whereas kappa, spinal primarily followed by supraspinal, and in case of delta, there is a effective component. The effective component of analgesia is primarily through the delta. Similarly, the other thing is that through mu receptor, there is a sedation, euphoria, whereas through the kappa receptor, there is a dysphoria or psychomimetic. Euphoria and dysphoria. What is euphoria then? Well, a dysphoria means the discomfort. There is a discomfort. And this dysphoria is through the kappa. So, analgesia is through all mu, kappa, delta. The effective form is through the delta. Respiratory depression is through all three. Whereas euphoria is through the mu, dysphoria through the kappa. Meiosis present primarily to mu and kappa.